Hi, my name is Andrea Ellis, and I'm a family physician. I've been with Trinity Clinic for 3 years. It was really the people that attracted me to Trinity Mother Frances. I knew several different physicians from church, internists, pediatricians, fellow family physicians, and specialists who worked for Mother Frances, and they had nothing but the best things to say. And so I really felt comfortable joining Mother Frances. I knew it was a group I could trust and a group that had a great reputation. I think coming out of residency, I wondered if I would be able to see enough patients. And the way that it works when you start, you just ramp up very naturally. And so by the end of my first year, I was busy, I was full, and I had learned how to become more efficient with my day. I was really pleasantly surprised at how easy it is to be involved. Very quickly after arriving, I was invited to join a few committees, and I find that it's a great way of really kind of keeping your finger on the pulse of the organization, getting to know the people you're referring to, getting to know your fellow physicians, and so I really feel like as much as you want to be involved, you can be. Trinity Mother Frances is very forward-thinking. We have been, I think, at the forefront of the patient-centered medical home initiative. We've been very interested in population health and not just the patient sitting right in front of us. And I think that is going to be key to reimbursement in the future. And so I think that we're always thinking about that next thing that's going to keep us viable in this very uncertain time. I think that the culture at Mother Frances is very friendly. From the beginning, even as a resident working in this community, I could call a specialist in the middle of the night from the ER on call and not get grief about it, and that just tells you what kind of community it is. I have found that the leadership at Trinity Clinic has been very supportive as I've been growing as a new physician. Early in my practice, I wasn't very busy, but very quickly I became so busy that I needed extra staff, and it wasn't a problem. I would say they added an extra nurse, and we've been very well staffed, and that really, I think, is across the board. That's one of the things I love about my job as a family physician is I do feel like I have a good work-life balance. I work hard when I'm at work. I go in early and I try to really put my head down, get my work done, and then I go home and I spend time with my family. I love Tyler, and I'm not from Tyler, and so it was such a pleasant surprise to find out how much it just felt like home from the beginning. It's a great community, it's a good sized town. It's big enough to have plenty of city amenities, but small enough that you run into people you know at the grocery store. I think a person who would fit in well at Trinity Clinic is somebody who enjoys being part of a team, because you're not a lone ranger, you really are working as part of a group. I mean, in your clinic every day, you're working as part of a group, but as a part of the larger group as well, with multi-specialty, with the multi-specialty clinic that we have. And so I think that someone who really enjoys collaborative care, who really just loves taking care of patients and wants to do it well and take advantage of being on a big, great team.